All right. Good afternoon, everyone, or good evening, I should say. It's 5:30. I just want to say welcome to this class or to this webinar. Just wanted to do this because I have so many people that are looking for health coverage, and they really just don't have an understanding of what is available out there for them. So I wanted to take these few minutes just to go over everything. I'm not trying to sell you anything. Please don't put any type of information regarding your personal health in any messages or anything like that to save your information for the right person, which is a licensed agent, if that's ever something that you needed to do. Just want to take a few minutes to see if we can have a couple people join, but if not, I'm going to just go ahead and continue. And then that way, people who watch this on YouTube or Facebook in the future, you can leave your comments after that or contact me personally. All right, so I'm going to give it just a few minutes. As you can see, I'm in sunny Florida. So for those of you maybe in other states where it's very cool, it's 80, I believe 84 degrees here today. So it's pretty brisk here for us. All right, so I'm just going to get right into it. I'll save this video for people to watch at a different time. I'll post it up later. But for those of you who may be on right now, let's go ahead and get started. So I want to just kind of tell you who I am, kind of go over the agenda so we can, I can make sure that everybody's on track, okay? All right, so here's what we're going to go over. Just a quick introduction to the types of health coverage, what's a subsidy, deductible, coinsurance, the types of networks, and then some of the common statements and then some recommendations that I have for you all out there in the world from my humble foxhole. So let's move on to here. So here's me. It's nice to meet you, at least virtually. It's nice to meet you. I am a retired 24 years in the United States Army, telecommunications chief, loved every bit of my time in service. It has made me who I am today, and that was me at my retirement ceremony there on the podium. As you can see, I was smiling really big because it was a very good day, very happy day for me and my family. What I do now is I'm not here to represent my company or anything like that. I'm coming to you just as a licensed agent who wants to see people get the best health coverage that's available for their situation. I am licensed in many states. I have other agents that are licensed in a lot more states. So if there's something that I can help you with after this, then I'll be more than happy to do that with you. I kind of pride myself, but it's something that definitely keeps me humble. Is I'm a volunteer at the Guardian Ad Litem program here in Florida, and it's just a very humbling experience. And I appreciate everything that they do for kids who are neglected, abused. Here in Florida, it's a lot of drugs that the kids have to deal with as far as their family. So, and that brings me to the last thing. I think I bring integrity to the table. I try to stay humble, and I'm definitely motivated to make sure that I'm taking care of people because that's my number one duty here. All right, so these are the types of health coverage. I'm just going to go over these briefly. Again, this is not an in detail down to the nuts and bolts. This is an overview to help spark some of the things that you may have in your mind that you didn't know, and it can help you kind of streamline the process. And I just wanted to be a part of that process for you to make sure that you're taken care of and you're not thinking some one thing and then it's really the opposite. So the first one we'll discuss briefly is the employer. So a lot of people want to be on group insurance. If you have four to 10 employees, 4 to 15 employees, typically group insurance is not going to make the most sense for you because the carrier, the insurer, they look at you and they say, well, there's not enough people for us to spread the risk around. So if you have an 18-year-old who is a clean bill of health and you have somebody who's 60 years old, say they have diabetes, that's going to bring up everyone's health coverage, or at least the price of the coverage that they're looking for in order for it to be fair. And if you use that insurance a lot, then your premiums are going to probably go up. I know that doesn't happen to anybody out there. Your rates stay the same for years and years and years. That's a little bit of sarcasm. But where it does make sense is if you have around, I would even say 25. It starts making more sense around the 25 employees that you have, plus to the thousands to the millions of employees that you may have. But if you're a small business, Usually the group type plans are not going to make the most sense, okay? Now the marketplace, that's your Obamacare. A lot of people think this is, bad. I'm not here to say it's bad or good. I'm just going to state the facts. The marketplace, Obamacare, is the right decision for someone who has a pre-existing condition. If they are walking around with no insurance, it is a guarantee. You have to have if you try to get it out of open enrollment, which is coming up November 1st through December 15th, sometimes they spread those out a little bit further depending on your state. But the marketplace is for someone whose income is low, closer to the poverty level, or they have a pre-existing condition. Pre-existing conditions are things such as heart attack, stroke, diabetes, things of that nature. And I always recommend to those clients that I have, that is the right place for you to be. And it's just because they're not going to qualify for some of the other things that we're going to talk about a little bit later. But that's typically where I send the clients. I have colleagues and associates that I talk to on a daily basis. I'm a member of the Chamber of Commerce, so I know plenty of people who are in the marketplace arena, and I always refer them to a person because I don't think you should have to go online and do all this by yourself because it doesn't cost anything to talk to one person. But we'll get more into that a little bit later. So that's your marketplace, that's your Obamacare. They look at your age and your income. And we're going to discuss the income here in just a minute and what that means for you if you do have lower income. So the next type, short-term insurance, this is if you just need, like, let's say you lost coverage, you didn't pay your premium and you lost your coverage and you need something to get you to the next spot, to the next open enrollment or whatever the case may be. That's where short-term can be an option for you. And definitely not long term, but definitely short term. If you just need to have something right now, you don't want to walk around with anything, then that's going to be an option for you. All right. Some of you may not recognize those words, but fixed indemnity is they take pride in paying you instead of the doctor or the hospital. It's a lump sum that's agreed upon. But, when you sign up, you might recognize that emblem there, the animal there. That's the duck. That's what they do. They do a lot more than that, but it's basically the bottom line is they're going to make sure that they pay you a lump sum to kind of ease your woes when it comes to the doctor's bills once you start seeing those doctor's bills. Okay. The next one is faith-based. This is beneficial for those individuals who have a certain faith. Sometimes it's not. The faith is wide open. Doesn't necessarily mean it's one faith. It could mean just if you have faith in a certain deity or God or whatever the case may be, that may be an option that you want to look at. It's definitely an option, and it's a shared community, and that's where your premiums and stuff go towards. Okay, and then lastly there is your private. Let me see if I can move me out of the way so you can see that for just a second. There we go. So that's your private. So they look at your age and your health. It is not an ACA plan. It's not Affordable Care Act is the acronym. They look at your age and your health. So it's a medically underwritten policy. And if you're pretty healthy, they will take it. So if you don't have diabetes or the major things that will qualify you for the marketplace, then that may be another option. So if you're healthy and you are on the marketplace and you make pretty decent income, there may be some options for you over there on the private side. So that may be something that you want to look into also. But they're going to look back in your records, 5-10 years, depending on your age. And if you once you meet that process, then you may find some savings over there. All right. All right, next slide there. We're almost done. Not too much. Don't want to drown you with information, but this is just to get you thinking. All right, so what should you look for? These are typically some of the questions that I ask people about that they do not really fully understand. So a subsidy, I mentioned this for the marketplace. A subsidy is, let's give you an example. Somebody tells me sometimes, they say, well, hey, James, I only pay $100 for my premium per month. And I say, okay, based off your age, and I look at their policy, the policy you're on is actually, let's just say $600. But because of your income, your annual household income, that's how they look at it, They said, well, you qualify for cost savings. Okay, so that may bring it down to $100, may bring it down to $0, can bring it down significantly depending. The closer you are to the poverty line, the more subsidy you're going to have. The further away you get away from that from the poverty line, the less your subsidy is going to be. And I'll throw this tidbit out because it's happened several times to people that I know before they were my clients. Let's just say when they signed up, they were making $15,000, $20,000 a year. Okay, that qualified them for a subsidy. Through that year, excuse me, I'm getting a quick phone call. Through that year, they actually made more money than what they claimed in the very beginning. So let's say they start off making $20,000. That's what they put on their form. They got their subsidy. At the end of the year, let's just say they made $50,000, which puts them over that poverty line if it's a single person. And what they do is when you do your taxes, they're going to come back and take the money that you should have been paying the month you started making more than that amount. Okay, so the subsidy, whenever I see that, I say, hey, yes, you're paying $100. However, the plan you're on is $600, $800, $1,000, whatever the case may be. So that is your subsidy, and that's how much money you're going to save on your policy per year. That's who the marketplace is for. There are no subsidies on the private side, for an example. The deductible. The deductible is, for most plans, the deductible is how much you have to pay out of pocket before your plan will pay anything towards your benefit. So if your deductible is $5,000, let's just say it's $5,000. Most people don't spend $5,000 a year on their policy. That's where I hear a lot of the frustration is, I'm paying all of this money for my premium per month and I never use my plan. Well, insurance is just that way. Even if you have, whatever car that you have, you don't buy insurance. You buy it for the just in case. The worst case scenario, I know I'm going to be covered, and that's how the insurance works. So if you're pretty healthy and all that stuff, then it's good just to have that background. So you start at like the bronze level plan. Those you're going to have to meet your deductible before any benefits are paid out. The higher level plans, on some of them, you will have some benefits before the deductible, but you're paying more per month. Your deductible may be lower. Right now, the limit for an individual is $7,900. For a family, it's $15,800. That's the max amount they can charge. But at least if something happens, that's the max that you'll pay. So you'll pay your $15,800, $7,900, whatever your deductible is. You're going to be taken care of after that. More than likely, there are some stipulations. You got to make sure you're within network and things like that. But that's what the deductible is. That is not your monthly premium. Okay? Hopefully that makes sense. Now, what is coinsurance? The coinsurance is after you have met. Let's say you have a low deductible. Let's say that deductible is $1,000. Let's say it's $5,000, whatever number fits your situation. There's something called a max out of pocket. So after you've reached your deductible, there's a max out of pocket. And let's just say your deductible is $5,000. The max out of pocket is $7,900. Your coinsurance is from the deductible to the max out of pocket. Okay, and you'll see typical terms such as 90-10, 80-20, 60-40, for example. So that means they're going to pay whatever that first number is. Your responsibility is the second part up to the max out of pocket. Okay, so the coinsurance is just that. It applies in certain other situations, but that's a general conception. That's what that is going to take care of. Okay. All right, so now let's look at the networks. The networks there are 4 networks. The EPO, I don't want to get too technical, but that's your exclusive provider organization. So I'm just going to keep it simple. EPO, if you think of this as your local network of doctors and hospitals, okay? You really have to search because think of your county, whatever county you live in, think of that as your doctors and hospitals. If you go outside of your county, for example, you're not covered. So if you live in one county, you work in another, and you got hurt doing something or on the way there, you just got into a little accident, then you won't be covered unless it happened at work. You have workers' compensation, all that stuff. But just in general, if you got hurt or had an accident. Outside of that, you're not going to have coverage. Very small network. The next one more people are familiar with, that's your HMO. HMOs are your state network of doctors and hospitals for whoever your carrier is. Okay, so I'm not going to name any specific companies or anything like that, but whatever your company is, if you left your state, left your network, because you find the benefit, with health insurance when you stay within your network. If you left your state, say you're a truck driver, for example, you go over the road, you go up and down the eastern seaboard, for an example. If you leave your state, you don't have coverage. You left your network. That's just how it works. The next one is called a POS, not what you guys are thinking. Just staying professional here. That's your point of sale. That is a combination of your HMO. It's a blend, I should say, a blend of HMO and your PPO, which we'll talk about in just a second. But it's usually a limited tier. What that means is there's very few doctors in the states, across the United States, that will accept the POS. It's very limited. I had a client that said she could only find 2 doctors in the states that she was regularly visiting, and it just made it very difficult because they weren't near her. Could change depending on your state. You just have to have somebody look at that for you. But POS, that's what that one is for. The last one is your PPO. PPO is your preferred provider, and I would say most of my clients, this is where they want to be because this is your nationwide coverage. This is going to be it's going to be much bigger. A lot of the doctors and hospitals accept the PPO more often than the other ones. Just depends on your state, depends on the doctor and hospital. But most clients want the PPO network because it's going to cover them typically nationwide, depending on your carrier. Okay, so that's just a quick synopsis of how the hospitals and the networks work. It's definitely important to look at what you currently have. If you have your policy, you're not sure about any of this information, you need to find a professional. Maybe it's me, I don't know, just to help you navigate to understand what you actually have. I had a client that she was a little frustrated because she didn't fully understand. She said that her agent said there were no other options out there, and I get it. People are trying to make money, but at the same time, it's making sure the people are on the right plan that fits their needs, their budget, their situation, because at the end of the day, I wouldn't want to receive the phone call that, hey, we're not actually covered. You didn't tell us about this and that. So I spend a lot of time educating before I talk to anybody about any type of health coverage and their whatever options they have. Okay. So just to stay on track, hopefully, if you have any questions, you can put them in the comments below. I'll look at those later. If I don't get any today, I'll look at those later and answer those, and make sure you get the correct information. All right, so let's move on. All right, so here are the common statements that I hear all the time. So I will tell you right now, and most of you've probably been affected by going online and looking for your own health. You're looking for health coverage quotes, for example. You're looking for health coverage, period, for your family, for your business, however that affects you. So going online, what that does is yes, you're going to put your information in there. You're going to put your phone number usually, typically, or you'll put your email address, and then over the next year, you're going to see probably hundreds of phone calls. And that happens quite often because sometimes I'll call people and they'll be so frustrated that they've gotten so many calls about health insurance, and they just don't know what to do. They say, do not call. Okay, so for that company, it's do not call. They're not going to call you anymore, hopefully, if they're smart. But it's just one company. What about the other 10 that your information was given to? So please don't go online looking for health coverage. Find somebody that can look at everything for you, do all the legwork, especially if you're running a business or your time is very valuable. You need to have somebody look for everything for you. And that's pretty much what I do on a daily basis to make sure my clients are taken care of, okay? The other thing I hear is I'm healthy. I'm good. Typically my young clients, but again, it's great you're healthy. It's good that you think you don't need coverage, but can you afford it if you do need it, if you're not healthy tomorrow? So I always recommend at least look at your options. That way you can do the best thing for yourself and or your family, because that's really when it's not available. especially if you're not in open enrollment. I've had this happen before. The client didn't qualify for the private side, so the marketplace was the best option for them, but they didn't have a qualifying life event. That's something, a qualifying life event is usually something that happens within the past 60 days or is going to happen in the next 60 days. You moved and you had coverage from your last job. You're about to be on Cobra. You're just going through all these different processes that I can help you with, but they don't qualify for anything. They don't have a qualifying life event. So now you need health insurance, but you can't get it because you don't have a qualifying life event. So I always encourage people that do not have their health coverage, let's just talk, let's have a conversation. If that's something that you're looking for in the future, at least you'll know where to go. I've heard one of my other clients say, how about you call me a week before you get sick so I can get you on a plan. All right. Nobody knows when, you're not going to be healthy or anything like that. So anyway, one of the other things is no insurance in years. I just go and pay out of pocket. Okay, that's fine. Some people have that type of money, or they just feel that's the only option they have because they don't have the money necessary per premium, but don't realize they qualify for a subsidy, or they just rather pay out of pocket. So they don't have insurance. Now, I am a little pushy on people who don't have anything. I want to make sure you're covered as soon as of today, because if you walk around with nothing, then you're going to be 100% responsible for that. I did have a client that said they need to think about it. They thought about it. That next weekend, the husband had a heart attack, and now they're calling me. Hey, now they need it, but there was nothing I could do for them other than help them in open enrollment or recommend one of the other options to best fit their needs. But getting it beforehand is way more important. It's kind of like your car. You have insurance on your car. You protect your car just in case something happens, but most people don't protect themselves for their own health. So that's just another way to look at it. So I need to think about it. If you have insurance already, I'm okay with waiting. I'm going to be patient with you, but I'm going to be a little pushy for people who don't have any insurance. Okay, so it's about taking care of you all and helping to find the best, okay? And I think that's about it. So here are the questions. I don't see any questions in the boxes below, and that's fine. I'm going to save it for YouTube. I'll have that up soon, and then also my Facebook. So if you have any questions, put in the down box below, or wherever you can, and I'll address them a little bit later. Okay. Thank you so much. Hope it didn't take up too much of your time. I think that was right at about 25 minutes. And thank you for watching. Whenever you watch this, have a great day and even a better life. Take care. And if you need anything else, as far as you want to contact me, don't put your information in the drop down. Go utilize my email address. Is James Health Advisor with an O, ADVISOR @gmail.com. Okay, James Health Advisor @gmail.com. Send me a note, send me some information that you want more information on. And if these videos work, I'll continue to do these videos to make sure you're informed all the time, so I can be a resource for you in the future. Okay? Take care. I appreciate you being here. Talk to you soon. Bye-bye.